Oh, you?
Yeah, not bad.
Thanks, Rob. Thanks for coming to Hacking Health
Thanks for
Quiz.
having me. It's been really good.
Tell me about yourself, and tell me about the reasons why you came to this event, and we'll just go from there.
Okay, about myself. I'm a junior doctor.
Yeah.
My second year, I'm from Gold Coast Hospital.
Yeah.
The reason why I've come to this event is I've always also been passionate about healthcare, but also about digital technology and design. I think this is a great chance to kind of immerse myself into these domains.
So, as a junior doctor, what do you see in terms of digital? You've probably seen some of the pictures and some of the other people that be in this room. When you're actually in the cold face of doing what you're doing, what does digital mean to you?
I guess it's interesting because we'll kind of reach a stage in the world where digital is pervasive. It's in everything, right?
Yeah.
And when we see it in our everyday life, it's natural, it's easy, it makes sense. But often, I guess, in healthcare, sometimes it's a barrier. Sometimes we feel like we could do better. Yeah. Not just for ourselves, but for patients.
Yeah.
Yeah.
So tell me about the problem that you brought to the event. You were quite passionate the other night when you did the problem pitch at the precinct.
Yeah.
And you did the first pitch here. So tell us about the problem.
Look, I think we have amazing care here. We have really good clinicians.
Yeah.
Supported by great teams across Queensland.
Yeah.
But I think we can really give a lot more value than what we do face to face. And statistics back this. When we chat to patients, we tell them loads of advice, give them information. We feel like we're doing the right thing, Here's another pamphlet, here's some more information. But then, you ask the patient, how do they feel? And a lot of them say it's overwhelming. They feel lost, they feel like, we haven't really gotten down to the problem. And I guess one of these key issues is, if we don't understand them, how do we make sure, or how do they take care of themselves in terms of taking medications, following advice? Yeah. And if we only have a 15-minute window to get to know them and to let them know these things, how can we bring more value out of that? Yeah. We give communication, we communicate with them, but what about afterwards? How can we improve the written communication we give to them? How do we improve the rates of giving written material, even though we know it's one of the best ways? And we know face-to-face engagement is number one in health retention and helping you connect to your roles.
Why is that?
So there's quite a few studies and they've shown if you want to change someone in terms of adopting your health strategy or quit smoking or anything like that, in terms of maintenance, face-to-face engagement is one of the best. Yep. The second best is virtual engagement. Okay. And we know face-to-face engagement is not scalable. We can't have 10 times more doctors and clinicians. Yeah. But we can scale virtual, and I think this is where digital comes in.
So virtual, I've coming from the IT angle.
Yeah.
We've even had a couple of guys in there that do virtual reality. You say virtual, what kind of forms is that? I assume that's not just face-to-face. I assume that's not telehealth either. It's something else.
That's right. So I guess virtual can mean those things. Absolutely, virtual reality can mean telehealth. But what I mean in this case is, think about the way you use apps on your phone, right? Yeah. How engaging are some of those apps? How do they keep you hooked, drawn into your routine? How do they change the way you wake up and eat breakfast and suddenly you're scrolling through news, right? That's virtual engagement. Okay. It doesn't have to be face-to-face. Yeah. It's designing technology that's so easy to use that the right thing to do is the right thing to do. At the moment, we say you have to do this, this, and this, and even the first step's too hard. How do we get rid of that friction so you're already doing the right thing?
Yeah. I've seen a lot of things from a design thinking perspective.
Absolutely.
That and one of the senior VPs that we had at HQ said, if it's not easier than pen and paper in terms of digital form, then we're missing the mark in some of these cases.
Absolutely. I think design thinking is something we really need to apply to healthcare along a range of domains. Whether it's clinician workflows or whether it's seeing how patients engage our service. We're really moving quickly. We have so much happening with IMR and all that sort of stuff, which provides a great platform to leverage off. I think now's a really good time to kind of get involved.
And probably coming back to one of those things you mentioned before about health literacy.
Yeah.
So that's come up a couple of times in some of these other videos that I've been doing, and getting that from let's say a 0 to even just an average of 2 or 3 takes significant change in terms of how you look at yourself and health in general.
Absolutely.
Do you see digital being part of that?
100%. I mean, if we look at population health, right, we think of the whole population of Australia, and we can kind of like divide them up into some groups, you know. There's people who wear Fitbits, right? Who,
not me.
Not you. There's people who wear Fitbits, are health conscious, think about their health, right? Watch what they eat, exercise, do all those sorts of things. They're the people probably in the top third, you know. We don't really need to worry about them. They're the high achievers, right?
Yeah.
But then there's a middle group who sometimes wear a Fitbit and 3 weeks later it goes to the cupboard. You know, they don't care about it anymore. It's a little passing thing. But they're interested enough that it doesn't take much to tip them across to here.
Yeah.
Right? And when we think about the care and value we deliver, some of these people might be nearly thinking of quitting smoking, might be, you know, on their way to getting skin cancer, might be on their way to heart failure, but still have enough cognition, enough health literacy to think, what if I change these now?
Yeah.
How can I change the routines, the habits, you know, the preventative health to prevent them from tipping down here and move them up here?
Yeah.
Interesting thing is, you know, we think of our healthcare system, right? The bottom, you know, 10% consume more, like the vast majority of our resources, right? But at the same time, we think about why, you know, who are in hospitals? Mainly the disadvantaged, you know? They might have come from lower socioeconomic backgrounds, right? They might have come from a rural area, they might be migrants, you know? They haven't had opportunities to develop the health literacy that others might have had to make sure that they are healthy. Yet, we haven't often connected and focused on that.
Yeah.
And I think, you know, if we're looking at value-driven care, if they're consuming a lot of value, we should really focus on how to make things accessible to them. The same way that, you know, other industries, other companies have made applications like Airbnb or Uber, how easy it is to tap on one button and get a car to you. So simple. You don't even think about it. In the past, it would have been a hassle to call up a taxi, right? How do we make the right thing convenient? Yeah. So how do we do that? And I think if we can make simple changes, easy to understand, and empathize with these people, we can really make a big difference.
So it's a really interesting one when you start talking about engaging with people, because the people that I see from a research angle are probably the ones that aren't necessarily they're more receptive to actually be part of that program. So you almost got to look at the whole, it's like a technology adoption cycle. So have you seen the hype curve? All right, so you got your early adopters, then you got your innovators, you got your late majority, and you got your laggards at the end. To actually get to the people that probably need it, it's probably not that cycle. It's probably on the tail end. But for us to actually get something off the ground, it's actually as you're saying, it's not the Fitbit people because they're already covered.
Exactly.
They're the people that do need to convert over, but actually understand, pockets of those that actually translates to everyone. And that's where you get your scale in terms of your research. So it'd be interesting when you actually go through this process to actually figure out, what's the cohort that is at least maybe the first bit, but also the launch pad for the next one, and you can learn more from that next phase, because you're never going to get the one size fits all. We don't work that way, and even if we do try to do that, we'll just go back into the old process that this is for us, or this is this, and it's not going to be impactful for everyone, because it needs to be very personal.
And I guess health is one of those things that are really complex. And if you want to say why aren't people in that bottom 10-20% engaging with the service or engaging in the healthcare, we really need to think of their health, their life as a whole. If they don't have secure housing, if they have financial difficulties, I know when I go to clinic and say, you just need to go to the pharmacy and come into this clinic, but I don't have a car. Suddenly something that's easy for you or me is really, really hard. You know,
Yeah.
it takes them 2 hours on a bus and a tram to get there. And then you think about it, if you had to go on a bus or a tram while you were battling with all these other things, would you go to that clinic?
Well, yeah, I had a conversation before around just keeping medications safe and under the right conditions.
Yeah.
What if I don't have a refrigerator for some of this stuff?
Yeah.
What do you do?
Yeah.
And I'm sure there's all these different elements to it, but the sum of those, it all adds up. It all adds up. So what do you think is going to come out of tomorrow when you stand up that stage and pitch to 300, 400 people from the eHealth Expo? What do you want to happen?
What do I want to happen?
Yeah.
Look, I don't know what's going to happen. I hope that people are interested in this project, this idea. We've got an amazing group working on this. I'm really happy, with the people that we have on our team.
Yeah.
And I think we've gone a long way in the last day or so in really refining the idea and getting to a stage where it is aligning with Queensland health goals at the same time, being something different, innovative, and scalable.
Yeah.
Ultimately, I'd love to hear the judgment panel's advice. If it doesn't work, why hasn't it worked? Because everyone has ideas, and it's iterative. You need to have some that don't really work to really learn from that to get better ones.
Yeah.
Obviously, I'm happy if this works. That would be awesome. So, I think whatever happens, it'll be good.
Yeah. So appreciate that you spent the time here, bringing your energy, bringing the problem that you've got, and in reality, if there's anything that we can do for you in terms of from a community angle, you know where we are.
Yeah.
So appreciate your time.
No, thanks for having me.
Well
Thank
done.
you. Thank
Cheers.
you.